Welcome. Thank you for watching. My name is Madeline Concepcion, and I am here to present you Autism, Nature, Treatment, and Neurodiversity. The aim of this presentation is to examine the nature of autism spectrum disorders and the impact of the diagnosis on the individuals and their families. We will examine some of the most controversial autism treatments and the ethical issues that these treatments raise in our society. Lastly, we will explore the diverse world of autism by studying the concept of neurodiversity. Understanding the nature of autism, acknowledging the needs of individuals on the spectrum, their human rights, and self-concept will promote the acceptance and successful integration of individuals with autism as valuable members of our society. I hope that you enjoy this presentation and that you will be able to take something away from it. We will start by defining autism. Autism spectrum disorders, or ASD, are a group of complex neurodevelopmental disorders affecting the brain. These are characterized in varying degrees by difficulties in social interactions, verbal and non-verbal communication, and restrictive and repetitive behaviors. We will start the fifth edition of the American Psychiatrist Association's Diagnostic and Statistical Manual, DMS-5, provides standardized criteria to help diagnose autism. The individuals must exhibit the following: persistent deficit in social communication and social interactions across multiple contexts, restrictive, repetitive patterns of behavior, interest, or activities. Symptoms must be present in the early developmental period. Symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. These disturbances are not better explained by intellectual disabilities or global developmental delay. Individuals meeting the specified criteria are then categorized in one of three levels of severity. Level 3 for those requiring very substantial support. Level 2 requiring substantial support. And Level 1 for those requiring support. You may be asking, how does this affect me? Well, in 2012, the World Health Organization directed a study on the worldwide prevalence of autism. The report concluded that an estimate of 1 out of 160 children are diagnosed with autism around the globe. These numbers may not represent the true prevalence of the condition due to the fact that many countries still do not recognize the condition or do not effectively monitor the number of cases. Some recent studies, however, reported rates that are substantially higher. For example, prevalence in countries such as South Korea estimates that 1 out of 38 children are diagnosed with autism. The situation in the United States is not much different than in South Korea. According to the Center for Disease Control and Prevention, CDC, the official estimates of children diagnosed with autism in 2012 is 1 out of 68. However, in 2015, the National Health Statistics Report announced the results of an unofficial survey which estimates that 1 out of 45 children are diagnosed with autism. What these numbers represent is that 2% of the United States population have a diagnosis of autism. These numbers also suggest that autism will continue to be on the rise by analyzing the trend of autism during the last decade, which reflects a 78% increase in cases since 2000. Chances are very high that you already know at least one person with autism. Because autism affects every individual differently and in varying degrees, treatments and interventions are designed to address the specific needs of a particular case. A great number of therapies have been designed to target many of the needs of individuals with autism. Parents and caregivers of autistic children often find it difficult to navigate the different treatments available. In fact, identifying the right treatment that will work for each child is particularly challenging. One of the most popular therapies used in the treatment of autism are therapies and programs that derive from or implement applied behavior analysis, or ABA. ABA is defined as the application of principles of behavior to issues that are socially important in order to produce practical change. For example, the treatment of autism. The core principle of ABA essential to the treatment of children with autism is that the consequence that follows a behavior controls whether that behavior will increase or decrease. The units of analysis used in ABA are called the behavioral contingencies, or the ABCs. The A stands for antecedent of a behavior. It's what is happening immediately prior to the behavior. The B stands for behavior, which is defined as anything a person says or does. And C stands for consequence, which is what occurs immediately after a behavior. In its original form, ABA involves the reinforcement of acceptable behaviors and the punishment of unwanted behaviors. This is done with the use of reinforcers such as preferred items, foods, or activities, and punishers such as undesirable events, loss of privilege, and other aversives. If you noticed, I mentioned the use of punishers as a method to decrease unwanted behaviors. These methods use aversives to achieve their goals. Aversives are those events, items, or environments that produce physical or emotional discomfort to a person. Dr. Ivar Lovers, a psychiatrist who is considered by many as the father of ABA, initially used aversives in the treatment of intellectually disabled and autistic children who displayed self-injurious and aggressive behaviors. Such aversives may include slaps, pinches, strong smells, electric shocks, restraint, seclusion, food deprivation, among others. Lovas later retracted his support for the use of aversives in the behavioral modification program, but there are still practitioners and providers today who favor the use of these methods. You may ask yourself, is this ethical? The answer is, it depends who you ask. The Judge Rodenberg Center, JRC, located in Canton, Massachusetts, is the only institution in the United States that still uses aversives, such as electric shock, to treat self-injurious and aggressive behaviors. Their main claim is that due to the high efficiency of the use of aversive to reduce or eliminate aggressive behaviors when compared to other treatments, the decision to use any other treatment would be unethical. They believe that the benefits of these methods far outweighs possible damage by ensuring a better quality of life for the individuals and their families. Among the advantages they highlight are the following: increased safety of the individuals and their families by controlling aggression, the discontinued use of psychotropic medication, promoting the advancement of social and academic skills, and promoting independence. Many parents and caregivers of JRC students have voiced their support of the use of aversives in treatments of aggressive behaviors in their children. They claim that such therapies have saved their children's life. The following videos will help you have an idea of what are self-injurious and aggressive behaviors and the impact of these behaviors on autistic individuals and their families.
Hand them to mom. Hand him to Mom. Don't restrain him. No, don't restrain him. Put the pillows between his hands. No, you have to do it, Kim.
Try it. Maya.
Kim, he doesn't know.
The idea that people say to do when you're not supposed to restrain him, you're supposed to put pillows between his head. Yeah, that works real well. Yeah, that's a beautiful idea. That's about as done as anyone. It's maybe have my son injured because of some mental case that thinks you can't restrain him.
You want some help?
Up.
Want some help?
Ow, ow, ow. Ow. Okay.
On the other hand, numerous organizations and human rights activists have voiced their opposition to the use of aversive-based therapies and have called for immediate action from the U.S. government and the Food and Drug Administration to stop the utilization of any aversives, especially those used by JRC. These groups claim that the use of aversive, such as electric shocks, seclusion, and the use of restraints for extended periods of time, and any other painful physical punishers constitute a violation of the 8th and 14th Amendment of the U.S. Constitution. They argue that it dehumanizes individuals and causes permanent or temporary psychological and emotional damage. Autism spectrum disorders is believed to affect children and adults indiscriminately of their race, culture, socioeconomic status, language, or religious beliefs. But as you have learned in this presentation, no autistic individual is alike. They all experience different challenges and possess diverse strengths and skills. The concept of diversity in autism, as expressed by these differences, is what it is known as neurodiversity. Neurodiversity refers to the diversity among human brains and the countless variation of neurocognitive abilities within the human race. It is described as a biological fact, a concept that recognizes the neurological differences as human variations. People with ASD, dyscalculia, attention deficit hyperactive disorders, dyslexia, among others, are representations of neurodiversity. The neurodiversity movement is a civil rights social campaign stimulated by autistic self-advocates groups across the world in an effort to encourage people with autism and the global society to shift from a negative perspective to one that is positive and promote inclusiveness of ASD individuals. Promoters of the movement seek to halt the common cause and cure approach to ASD, claiming ASD is not an illness that needs to be eradicated or cured, but accepted and valued. In his presentation, Sinclair described ASD as an integral part of the individual, such as having blue eyes or being shy or extrovert. To quote Jim Sinclair, autism isn't something a person has or a shell that a person is trapped inside. There is no normal child hidden behind the autism. Autism is a way of being. It is pervasive. It colors every experience, every sensation, perception, thought, emotion, and encounter, every aspect of existence. It is not possible to separate the autism from the person. And if it were possible, the person you have left behind would not be the same person you started with. This is important, so take a moment to consider it. Autism is a way of being. It is not possible to separate the person from autism. In conclusion, the increasing global prevalence of ASD especially in the USA, urges us to take action and start thinking about the life of all those who are impacted by autism. ASDs are no longer a rare diagnosis, and chances are very high that you already know of someone with ASD, either a friend, a colleague, or even a family member. As with any other minority group, it is important to understand their struggles, accept, understand, and value their differences in order to promote their inclusion into our society. I encourage you to take 2 more minutes of your time to watch the video of 17-year-old Carly Fleischman, a nonverbal autistic woman, and her perception of the world, based on an excerpt from her book, Carly's Voice, Breaking Through Autism. Thank you again for viewing my presentation.
I can't wait for a coffee. Oh, hello, barista.
What do you girls want?
Skim soy latte?
Taryn, soy can't be skim.
Hot chocolate? Orange juice?
No, Dad, I want a coffee. Hot chocolate? Great.
So, I was thinking of going to Sarah's later. Could you give me a ride?
Yeah, sure. Are you cool with taking your sister?
Yeah.
Wait, what? I have my own plan.
Carly.
Okay, I'll see you tonight, okay?